Dr. Deepak Dube. He is general medicine physician and internal medicine as well. What a pleasure to have you with us, Dr. Dube. If you can shed some light, what all you have heard so far and how are authorities gearing themselves up for this Nipah virus?
What we have heard is, as you already told, that two cases have been detected in India, and it is like not like very commonly found virus. It's an RNA virus, and it is a zoonotic virus. That means it spreads in animals, and it can spread from animals to humans. And the brood bat is the carrier of this virus, and it can spread from person to person when it is there in humans.
What are the symptoms, Dr. Dube, and what all the patient experiences?
Symptoms are usually general symptoms like cough can be there, fevers, throat pain, and headaches, body pain. And one particularly specific symptom is the development of encephalitis, which leads to severe headache, confusion, even seizures and coma. And these are the symptoms which leads to the fatality usually, which is quite high in this virus.
Right. And also, doctor, could you talk to us about this fact that, well, we've heard that there is no vaccine as such in place, but definitely a couple of trials, couple of, organizations trying the Nipah virus vaccines. Could you talk to us a little bit more about this? What should individuals be doing just in case they have come in contact with an individual infected by this virus?
Vaccines are under development right now. There is nothing like that. But if there is a definite contact with the person, then of course you have to quarantine yourself and completely isolate. And you have to inform the authorities about the exposure and prevent like transmission in general, like wearing mask and cleaning your hands and keeping isolated till the time at least the incubation period is say 14 days. So you can develop the symptoms any time during this period, 2 to 3 weeks.
Detrimental are they, doctor? I mean, what are the symptoms? How detrimental are they? And what happens if it goes untreated?
If it is untreated, see, many patients, they will respond. They will become all right after the initial symptoms of fever, cough, and flu-like symptoms. But certain of the patients will develop encephalitis. Now, as I told, the fatality rate is up to 40 to 70%.
Oh.
But many of the patients, they can recover back with some residual neurological problems like change in personality and development of some seizure disorders and all can happen.
And what about children and senior citizens or elderly, doctor?
They are more prone to develop severe infections, these and children. So, that's the thing. But in general, the fatality is quite high.
And does it have the potential to convert into a pandemic, Dr. Deepak?
Right till now, we haven't have had pandemic of Nipah virus. It's usually spread in certain areas, initially diagnosed and contained very well before we had in 2024.
Okay.
22 cases only, but they were contained quite well.
But still, there is no vaccine. If it was, it developed 2 years back, the cure is still not available.
No, there is no vaccine. Only symptomatic treatment, isolation, and prevention.
Right. Now, we understand that the Nipah virus is a zoonotic virus that jumps from an animal to a human and can be spread from a human to human. Now, is there different ways that probably science or a little bit of education could help us prevent this at the onset of it becoming, this spreading, in fact, at this rapid space?
Yeah, once these kind of things are detected, like 2 cases are detected now, there is to be high alert in that endemic area where this has developed, and has to be a very vigilant approach from the health authority by recognizing the symptoms and diagnosing it, which can be done by the body fluids PCR test, the cerebrospinal fluid or throat swabs. This can be taken to test the virus, and if found, immediately patient has to be quarantined and isolated.
Dr. Deepak, so far it appears that it's more in the South Asia belt, because Singapore's Communicable Disease Agency yesterday, they've set up this temperature screening at its airport for flights arriving from areas affected by
Right.
the infection. But obviously,
Right.
because these days everybody travels, so the
Yeah.
potential of spreading would be high. What
Yeah.
precautions for people who have to travel would you suggest or recommend them?
Usual precautions of wearing masks. And if you are traveling to an endemic area, then better to be wearing the mask and prevent a distance like we had during the COVID.
During the
Those are the
COVID?
general
Okay.
precautions. Wash your hands frequently, and when you're eating fruits and other things, be careful that they are not, as you said, bitten by, or you find any marks like that, and properly washed fruits like that.
Well, we're talking about the symptoms here, doctor. Now, is it possible that you could have the virus and you could be a asymptomatic individual where you don't show any signs or symptoms, and probably in the next 2 to 3 weeks, you'd see your body reacting very different?
Yes.
And also, please
That
add
is possible.
pregnant women and kids as well, Dr. Deepak.
As we have seen in pregnancy, the intensity of the disease or infective disease can be more severe as it is in influenza. Similarly, in Nipah, the same applies, and there can be a severe disease. So you have to be very careful, and screening at the earliest is the most important thing you should do.
Right, and you were talking about asymptomatic individuals where you don't show any signs, doctor, and then you realize after 2 to 3 weeks that you have contracted it. Could you talk about this in situations like that? What is to be done?
Asymptomatic individuals can be there, and not all patients have similar symptoms. Not all will develop encephalitis. So some will develop encephalitis, some will develop just sore throat, body pain, fever, and some will remain asymptomatic. But if there is an exposure to a close contact, then you have to screen the patient for the disease.
And it's so interesting, Dr. Deepak, you just mentioned a few minutes back that there's once you're diagnosed, then you're isolated. So it's more of that quarantine style that we have witnessed earlier during Corona or COVID days for a week or so, or is it not exactly for all that time?
No, you have to get negative results before you can usually 2 weeks. You can
2 weeks.
consider it as a
So quite
as a
similar to the
complete-
same pattern.
Right.
Yeah.
Doctor, also let's ask you this question. Now, does it spread through air, through food, or through
Close
touch, through close contacts, or, and how long does it actually last once you contract the virus?
If the patient develops encephalitis, then the symptoms might last, and it will be in the cerebrospinal fluid for a longer time. As I said, the incubation period is 14 days to 3 weeks. The patient can get exposed to a virus, but the symptoms will develop later on once the disease develops. So you can say that up to 2 weeks to 3 weeks is the period from the initial symptoms to the point where the patient can have no signs of symptoms and negative for the virus.
All right. And how does it spread?
It spreads by droplet, it spreads by contact, direct contact, it spreads by eating like infected fruits. Then there are other animals, like fruit bat is the one carrier, and then it can spread also in other animals, especially the pigs and the pig farms which have they are exposed to the disease and vulnerable to development of Nipah virus.
How do you treat Nipah virus, doctor?
Symptomatic treatment, like for the flu and cough, you have to first isolation, then you have to give medication to reduce the symptoms. And when the developing encephalitis is there, then it's basically you have to keep the patient in ICU. You have to give some medications to reduce the swelling in the brain, and the symptomatic continue the symptomatic medication and critical care, treatment where you need to hydrate the patient and give the nutrition. So all these things will be going into a critical care treatment plan.
Especially for children and elderly. Dr. Deepak
Yes.
Dube, thank you so much for talking in detail about Nipah virus, and I hope that it's controlled sooner than later, and we start moving or living a life or perhaps business as usual. Thank you so much
Let's
once
hope
again.
so, yeah.